Welcome to the Bronchiectasis and NTM Association podcast, where we're here to share valuable insight from leading health experts, heartwarming stories from people living with bronchiectasis and NTM lung disease, and the latest in health research and treatment. Please subscribe, follow us on social media, and visit bronchandntm.org to learn more. Just a quick note before we get started. This podcast series is intended for educational purposes only and is not suitable for medical advice. Please consult your medical provider if you have any questions. Thank you for joining the Bronchiectasis and NTM Association podcast. Today we have a special guest that is Katelynn Schneider. She is the CEO and founder of a medical coaching and advocacy agency. And Katelynn comes to us with a unique perspective as a nurse practitioner in pulmonary medicine and an expert in helping people navigate their healthcare system, as well as how to be their own advocate. In this episode, she will share valuable advice on how to prepare for medical appointments, how to improve communication with your healthcare providers, and how to overcome challenges such as anxiety, forgetfulness, and the overall feeling of overwhelm. So welcome, Katelynn. We are so glad that you're here today. And can you just share a little bit about yourself?
Well, thank you. Thank you for having me on. I am a nurse practitioner. I have been in healthcare since I was 18. So my entire adult life, I started out as a nursing assistant. I worked in food services at nursing homes, and then I went on to become a nurse, and I spent several years working in the ICU and taking care of very sick patients. And from there, I just knew that I really wanted to help people learn to avoid getting into that situation. So I went to school to become a nurse practitioner with the goal of being in primary care so that I could help people learn to take control of their health so they didn't end up in the ICU. Of course, our plans are never exactly what we get. So I ended up working in pulmonary care, which is unfortunately where you see a lot of pretty sick people on a daily basis, dealing with COPD, dealing with asthma, dealing with things like bronchiectasis and all of the other lung diseases that we see on a daily basis. So from there, I was seeing a lot of sick people. And I knew I still wanted to help people learn to take control of their health. So I actually took a sidestep outside of the traditional medical system, and I started working in holistic care and functional medicine, where I just got to see a transformation in people who were able to learn to truly take control of their health and their lives, and how much of a difference it made. So I've had so many different perspectives in healthcare, which has just been an amazing education for me. The goal when I work with any of my clients is to get them to be in control of their health, because I feel that so many people just think that their health is left up to chance, that things have already happened to them. And now they go to the doctor, and the doctor is going to recommend this test, and then this medication procedure, and they don't feel like they have any control. So the goal really is to help people to learn to take control of not only their health, but also to be active participants in their health care so that they can actually reach their goals and they can feel their best, live their best lives.
So chronic disease means long lasting, and they often experience various amounts of challenges and require a lot of support, both emotionally and physically, and ongoing management. So how does a coaching and advocacy group fit into supporting patients who have something like bronchiectasis?
Absolutely. Chronic diseases are hard, and I don't expect anybody to step into this world and have a complete understanding, because we're not all doctors. We haven't all spent, 20 plus years working in healthcare like I have. So the goal here really is to try to give people an understanding of their body and their health, so that they can start asking the right questions of the doctor, so that the doctors can then inform them and educate them. The problem now that I see for a lot of patients is that they go in and they don't even know what to ask. So then the doctors will come in and they'll just start, following their agenda and giving them all of the information. But if it doesn't align with what the patient actually wants, then it's not doing anybody any good. So my goal is for each person to just understand a little bit about their health and a little bit about the healthcare system so that they know how to get what they need. And they're not just at the mercy of waiting and waiting and waiting for more tests and spending more money on different things that may not even get them to where they want to be.
Yeah. So I actually read something that I found was really interesting is the average length of a visit in a doctor's office or a provider's office is 17.4 minutes. And the median length of those would be about 15.7 minutes. So breaking that down, a patient was speaking about 5.3 minutes and a provider speaking 5.2 minutes. And they covered a variety of topics in such a short period of time. In fact, they covered about 6.5 different topics and diseases in that conversation. So, what strategies would you recommend to help patients and even family members to be able to effectively prepare for that visit?
Absolutely. That's incredibly heartbreaking, isn't it? That is a strategy or something that we need to strategize for, because knowing that, and I think most people know that they're going to the doctor and they're only going to be with them for, I think 7 to 9 minutes is kind of an average time, if we are looking at all different types of appointments. But being able to know exactly what you're looking for when you go into that room is so important. And one of the strategies that I think is actually something that's very beneficial for patients and things that I always recommend are making sure that you know what your symptoms are. Because if you have 5 minutes to talk, then you not knowing and having to sit and try and ponder when your symptoms started or what it actually feels like, you don't have time for that, unfortunately. So I always educate people that they have to make sure that they know that they keep symptom journals. And truthfully, if you have a lot of questions, we have the benefit nowadays of having the electronic medical systems. You can send questions to your providers even in advance. So you could even send questions in and be like, hey, these are the things that I really want to talk about with you. So that way they know and they can come prepared as well.
Yeah, that's a really good point. I never thought to really mention that, but using those electronic medical records are really an asset for patients to, like you said, just to fill out what their symptoms are, what their questions are, have their provider review, and then that way they can have more of a specific conversation. I love that idea.
Yeah.
So it's really important to prepare for those visits. A person's understanding of like a chronic disease in their first year is going to be considerably low. And that's because the overwhelming feeling of shock of their diagnosis, getting anxiety, all of those things. So, what are some key questions that patients should ask their provider during their appointment to ensure that they're getting the most out of their visit? If they aren't putting that information in their electronic medical records to ask ahead of time, what kind of questions would you suggest a person come to the doctor with?
Yeah, absolutely. Because it is important to be prepared with questions. So one of the questions that I always would recommend is to make sure that you ask for all the options. Because oftentimes the way that our system works is it's kind of like a hierarchy. They start with, this is what we start with first. This is the procedure. We have to start here. And then if that doesn't work, we're going to go to this step and then this step and this step. And they just follow it in a time-wise fashion. So it's really important for each patient to truly understand what that process is going to look like. Because if they go in and the doctor wants them to try this medication and they think, okay, well, I'll try this, and they only take it for a week or two, and then it doesn't do anything because it maybe didn't have enough time to do anything, and they stop that medication, then they might just be setting themselves back. So if they understand that, okay, we have to do this for a certain amount of time, maybe it's a month, maybe it's 2 months, 3 months for these medications to take full effect before we know. And then if we see no results, then this is the next step. So really having the ability to understand what's going to come, because I think a lot of people are planners and they want to have some idea. So even if it's a test, okay, maybe we don't know what's going on yet. Maybe you're coming in here and you're short of breath. So what's the first test that we're going to do? And if that doesn't give us an answer, what's the next test? Because unfortunately, we only get that 10 minutes with our provider, but it could be months in between when we see them again. So knowing and understanding what that process is going to look like. So again, we can utilize that medical electronic system to our advantage, being like, okay, well, I did this test. We didn't get any results from it. Can we move on to this next thing that you already told me we're going to do? So just really utilizing all of those tools and having the knowledge up front is so important.
Yeah. And it can be really tempting to search for answers on Dr. Google, right? Or look to social media groups and influencers, or even to get our information from commercials. So it's just important to consider where your resource is coming from and looking at that and taking it as face value. So if you're on a support group and people are throwing out their experiences, just take that as a grain of salt, but going to your provider and looking for, or even having your coaching service, having somebody there who is going to be your advocate to walk you through these steps. And when you have those questions or concerns, just to make sure that you're feeding that back into a more reliable, consistent resource.
Absolutely. Absolutely. You nailed it right on there, because there is so much information out there, but there are no two bodies that are the same. So what worked for one person isn't necessarily going to work for you. So for you to truly understand from a safety standpoint too, even what some of these things are, and to have all of that knowledge, we need the doctors. They have a very specific knowledge set that most of us don't have. So we need them, and we need to collaborate with them. So that's why it's important too, that maybe even if you see some of these things and you see, okay, well, I've heard about this, bring that to your doctor too, because they might have some, knowledge that says, okay, yeah, this might be good for you, or there might be something going on in your body that this is really not going to be helpful for you. And that can save you a lot of time and money in a lot of circumstances if you actually get the right advice and enough about your body. So yes, Dr. Google is very dangerous place for a lot of people, but because the information is so readily accessible now, it's easy to do. And I think it's just important, like you said, to have the right information, going to the right people, the professionals that know you and are going to help guide you. And that's the other thing about having a medical coach too, because if you have somebody that actually has the time to sit with you and really dig into your medical concerns and your health history, it makes a huge impact, because how many of us see how many different providers and specialists now? Do we even have one provider that has the full picture and really knows? So having any provider or having a coach guiding you can be a huge game changer.
Yeah, I like how you mentioned having the time, because like we talked about the statistic about how much time a provider is able to spend with a person, looking to see how we can pull it all together, and how even with bronchiectasis, how a postnasal drip and having acid reflux and all of these different things, it might look like they're separated, but really if they come together, it could be what is causing these exacerbations and symptoms and all of that. So looking at everything, and like you mentioned, a holistic approach in your passion for this, looking at all of that together really can make a difference to pull it all together to be able to have the best quality of life.
Absolutely.
So going to a provider's office, we know, can be very anxiety provoking. We have white coat syndrome, which is your combination of anxiety and elevated blood pressure. And we can have forgetfulness and just overall that feeling of overwhelm. If a patient encounters this when trying to communicate with their healthcare provider, what would you recommend they do to overcome these?
Absolutely. This is a hard thing, because I think that most of us look to our providers as a person in a position of power, and they should be respected. And that is an amazing position that they have. However, they're not the expert on you. And I think that is the biggest shift that most of us have to make. They have the best intentions, but they don't know you like you do. You are the only person who lives in your body. So for you to be able to fully explain to them what's going on is so important. So this is a lot of mindset work for a lot of people because, as you mentioned, we have white coat syndrome, and this is a physiological effect. But then those are also similar things that can make us a little bit more forgetful. So, what are some of the things that we can do if we find ourselves in that situation? The first thing that I recommend to all of my clients and people I work with is to work on stress reduction techniques. Okay. So, this is something that you and many people who have lung disease will already have heard about is just abdominal breathing and doing different breath work. And while that's amazing for us in a lung standpoint to get the oxygen we need, it's also huge in us from a mindset standpoint because it can actually pull us from that point of fight or flight and stress and bring us down into that resting place where we can think clearly. So I always work with my clients to teach them that. But then also some very logistical things that you can do is obviously write down all of your questions before you go in. Prepare to take notes. And honestly, I would even record those sessions when you are with the doctor because chances are they're going to say something to you in that time. And if you're not in the right headspace to comprehend it, especially if they have just diagnosed you with a chronic disease, then you're not going to remember everything. We don't remember that much of what is told to us. So if we have the ability to go back and re-listen to it, that can make all of the difference. If you have somebody that can go with you, this is great too. But how many times do we try to recollect something with, our partner and we have two totally different recollections of what happened? So having a recording can be huge for you to be able to remember and relay and then go back and listen to it and then send questions and say, okay, we talked about this. These are the questions that I now have.
Yeah, that's a really good point. I love using breathing techniques. So if anybody is looking for different breathing techniques, you could go to broncandntm.org. But Katelynn, do you have any specific breathing techniques that you like to do, like the diaphragmatic breathing, the pursed lip breathing? What would you recommend?
Absolutely. So the diaphragmatic breathing, that's always the thing that I teach. So I call it, abdominal breathing or belly breathing. And this is just making sure that we're not doing that shallow breathing because most of us are shallow breathers using those chest accessory muscles. So it's actually a really easy technique to learn. And the way that I always teach it to people is to put, one hand on your chest and one hand on your belly, like at your belly button. And try to make sure that when you breathe, you move the belly hand first. And if you can get it to the point where you don't even move the hand on your chest, this is a very good thing because we want to use that diaphragm because it's our main muscle of breathing. We're going to open up all of our air spaces. So especially for people with bronchiectasis, with pulmonary atelectasis, we have to be able to pull all those air spaces open so we're getting the good oxygen in. Pursed lip breathing, like you said, too, is also a phenomenal technique because if we can keep that air in our lungs a little bit longer, and then also it causes a little bit of that vibration sense in our lungs too. So it can break up any little mucus plugs that might be sitting in there. So these are all great techniques. There's so many different things that you can do, but, and for people, especially with lung disease, talking to your provider and knowing what might be the best ones for you too is going to be really good because they'll know your background, they'll know your history, and they'll say, okay, yes, do this. And maybe you don't have the capacity to do it for as long. Some people teach like the box breathing. Maybe you can't hold it for that long. So what can you do? And that's why it's crucial that you work with your provider for some of those things. But the abdominal breathing, diaphragmatic breathing, and pursed lip breathing, anybody can do. And the pursed lip breathing, honestly, is just when you breathe out, when you exhale, just breathe like you're blowing out a candle. It's very easy to do. So do it as much as possible. It keeps that oxygen in your lungs longer so that you can get it into your bloodstream where it needs to be.
So, what kind of advice would you give patients looking to build a stronger relationship with their healthcare team?
It's a great question because, this is such an important thing because it does need to be a collaboration. Because like I said, you're the expert on you, but they're the expert on the medical stuff. And I would even include in there even the pharmacists as part of that team because they are truly the experts on the medications. So really being able to foster all of those relationships and having good communication is the best thing. Going in and speaking clearly with your provider and knowing exactly, like I said before, logging what your symptoms are, when they start, how long they last, what makes them better, what makes them worse. All of these things can be very beneficial. And they can give your providers great information so that they don't have to continue to order more and more tests. If they can really look at the symptomology of everything for you, they can help you get down to the bottom of what the question is much quicker and help you reach your goals. So really just having that clear communication with them is so important.
Yeah, and trying to, work through that anxiety and trying not to put them on that pedestal where you feel that you can't approach them.
Yes, they are still just people. We are all people and we all do different things. But, the basis of the matter is we should all be treated with respect and kindness.
Could you leave us with one final piece of advice for those living with a chronic disease?
Absolutely. So you can find me on our website, and that is just ksnmedicalcoaching.com. But I also have a presence on Facebook. I have my KSN Medical Coaching and Advocacy Facebook page, and then also my personal Facebook page where I do a lot of educating as well through there. So that is just Katelynn Schneider. And if we're able to, I would love to, I can send you the link for both of those profiles as well.
Yeah, absolutely. We'll make sure to link that in the show notes as well. So what is, could you give us like one final piece of advice that you just want to give to patients managing a chronic disease?
Absolutely. So I think the biggest thing that any of us should know is that it is your health and it is your life. So only you can be in control of it. And if you want to live your best life and have your best health, then you have to be an active participant in your healthcare. We can't be passive anymore. We have to speak up for ourselves and know what our goals are so that we can work with our providers to reach those goals.
Thank you so much again, Katelynn. It's been so great to have you today.
Thank you so much.
Thank you for tuning in to the Bronchiectasis and NTM Association podcast. We hope that you found today's episode helpful and inspiring. You can stay connected by joining our online community, following our social media, and visiting our website for more resources. And of course, subscribe to this podcast and join us next time for more insights, stories, and tips to help you live well with bronchiectasis and NTM lung disease. Until then, thanks for listening and be well.